balance. Ang tamang paghahati ng oras at atensyon sa trabaho, pamilya, kalusugan at personal growth. Lunes hanggang Biyernes, alas 6 hanggang alas 7 ng gabi, know the secrets of having a meaningful and balanced life. Sa Life Balance, dito lang sa DWIZ 882, ang himpilang may todong lakas.
Welcome mga ka-DWIZ. Tayo po ay ngayon ay nasa Life Balance. Dito pa rin sa 882. Ako po ang inyong host. My name is Toni. At isang oras na naman ng makabuluhang kwentuhan ngayon. Alright, we have a special guest. Of course, we'll have Dr. Ana Monica Estrella, a rheumatologist from Makati Medical Center, the hospital with a heart. Ayan, let's please welcome our Dr. Ana. Good evening po, Doc.
Good evening, ma'am.
Ayan, okay. How are you, Doc? Okay lang po ba kayo?
Good naman.
First time niyo po ba sa Life Balance?
Yeah.
Yes, okay. Ayan. So, Doc, we have actually, our topic tonight is understanding osteoporosis. Ano po? So, marami po tayong questions dito from our listeners and audiences. So, ito po, let's go right through our first question. Ano po ba ang osteoporosis at bakit po ito tinatawag na silent disease? Ayan.
Okay. So, osteoporosis, generally, it's talking about how brittle the bones are. No? So, pag sinabi nating osteoporosis, malutong ang buto po. So, we usually tell patients it's a silent disease or medyo wala tayong sintomas na nararamdaman, kusang lumulutong ang buto natin, at kapag may naramdaman na tayong sintomas, komplikasyon na ito ng osteoporosis. Ang mga sinasabi kong mga sintomas, pwedeng pain, and this could actually mean na pwedeng may fracture caused about by the osteoporosis.
Okay, so pagiging marupok or brittle ng bones, ayan po. Gaano po kalaganap ito sa Pilipinas, ang osteoporosis?
Laganap po. Generally, when we age, everyone po sa atin, our bones are actually a living organ in our body. No? So, it undergoes changes, and one of the changes is paglutong niya. May mga pagkusang paglutong po ito. However, kapag ang paglutong niya ay pathologic na or hindi na naaayon, or sobra-sobra na, it can cause po itong disease. So, it's a natural process of our bone, but if it's a disease already or malutong na, kailangan ng intervention.
Okay. So, may age po ba nagsastart ang osteoporosis, Doc?
As I mentioned earlier po, parang ang buto, it undergoes changes, no? So, kumbaga, as we age, medyo may peak bone strength tayo, at also at a certain age, nagde-deteriorate ang bones natin.
But does it occur to younger ages?
Opo, it can kapag may mga risk factors tayo, no? May mga ibang sakit, ibang mga gamot na tinitake, that makes our bone more brittle. But usually, mga 65 and up, postmenopausal na babae, 70 years old na lalaki, we usually already tell them to have them screened na po for brittle bones or osteoporosis. Yes.
Mas risk here po ba ang mga kababaihan compare sa mga kalalakihan?
Yes.
When it comes to
because estrogen, especially kapag menopause na po tayo, mawawalan tayo estrogen. And estrogen is a key hormone for bone health po. So yes.
So Doc, kanina off-air, no, we're talking about naman arthritis. So ano pong pagkakaiba naman, since sabi nyo na may misconception yung mga tao na ganun. So what is arthritis naman and osteoporosis? Ano pong pinagkaiba nila?
That's a very, very good question, Ms. Toni, no? Kasi magkatunog sila, no? Osteoporosis, patients would also ask osteoarthritis. Pag osteoporosis, you mentioned kanina yung very, very perfect phrase, brittle bones or malutong na buto. Pag arthritis, we're talking about kasukasuan o kung saan nagtudugtong ang buto. It's like the hinge of our skeletal system, no? So, magkaiba po sila. Ang osteoporosis is lutong ng buto. Ang arthritis talks about sa issue sa mga kasukasuan ng nating katawan.
Okay. So, maaari po bang, the question here is, maaari po bang magkaroon naman ng osteoporosis sa mga kalalakihan? So, yes din.
Yes, opo. Pero mas at risk lang ang mga babae at an earlier age because of menopause. But male, mga kalalakihan, also kasi lahat naman po tayo ay tao, our bones generally undergoes changes. So they are also prone to having osteoporosis at a certain age.
Doc, may mga mapuntahan naman natin kung paano naman po maiiwasan pinakasimpleng na pwede natin gawin para maiwasan ng osteoporosis.
Marami actually, madelay ang pag-appear ng osteoporosis. Number one, making sure that we have enough calcium in our system, vitamin D in our system. They could be for calcium, they could be in diet sa pagkain. Dairy products, milk, tofu, soy, those could actually be helpful to make sure that we have enough calcium in our body.
So, how enough is enough? Like, how much calcium should we take in a day?
Magkakaiba po sila per age group, pero usually those who are prone or at risk for osteoporosis would need 1,200 milligrams of calcium a day. It could be in the form of diet or supplementation to make sure that our bones are having enough calcium, no? Calcium kasi po is very, very important in our bone health. For me, I would usually tell patients, no, ang calcium ay parang building blocks of our bones. So, if we don't have enough calcium, we are more prone to having malutong or brittle bones.
Yeah, and also calcium is also good for our teeth, our hair, di po ba, as well as skin. But just a visualization ng mga nanonood sa atin, ano po, Doc? Gaano naman po kadami yung, is it 1,200 milligrams of calcium? Kung isasamap natin siya sa baso ng gatas, gaano kadami yung 1,200 milligrams of calcium?
Perfect representation yung gatas po. Kasi usually maiisip talaga natin, paano, magkano or how much naman po, no? A glass of two or a glass or 2 glasses of milk a day would be enough. Considering po that we also have other sources of calcium in our food naman din.
Okay. So, when it comes to food naman, Doc, so ano po yung mga other sources of calcium? Maliban sa tofu or milk, yes.
Opo. So, generally, dairy products would be one. Other forms of milk, no? So, other patients would tell us, lactose intolerant po ako, pangit ang tiyan. Non-dairy sources po would include almond milk, soy milk. Those would also have enough calcium. Yogurt would also have enough calcium.
Cheese, though.
Cheese po,
as well,
very important. And then, having a nice balance of diet also, and I would like to include po vitamin D, no? Kasi ang calcium is also, absorption of our calcium is very dependent on vitamin D levels of our body, no? So if we need to have vitamin D enough so that our calcium that we're taking is also absorbed properly by our gut.
Okay. So, Doc, when you're saying vitamin D, ito po ba yung vitamin D supplement or the usual conception naman ng mga karaniwang walang medical background, na magpapaaraw? Ganun po ba ang vitamin D, Doc?
That's not wrong po, no? Ang vitamin D sa araw nakukuha, pero medyo mahirap pong magpa-araw kasi it's always a risk balance, no? Sunburn naman, mga dangerous levels of being exposed to the sun yung concern natin. But it can also be in the form of supplements po. So regardless naman, for majority of patients po, we don't really, the healthy amount of sun in the morning, 6 o'clock to 7 o'clock in the morning.
6 to 7 lang pala, Doc,
well, that is the po, no? Pero advisable.
Yes.
But vitamin D po talaga will be usually more absorbed kapag tanghalian na.
Okay.
So, medyo hindi rin po natin ma-advise push sa ganun dahil heat stroke naman po ata yung magkakaroon tayo.
Kasi lalo na dito sa Pilipinas na it's always summer.
Yes.
Ngayon, so lalabas ka lang sa pintuan. So, pag naman ganun, Doc, gaano katagal na kailangan magpa-araw
15 minutes po.
15 minutes,
Opo.
okay.
But usually, we supplement na lang din with vitamin D. And there are a lot of different supplements already that are available.
So that 15 minutes, enough for me to burn my skin. Or to have natural blush. Opo, ano. So, ayun naman, Doc, ano-ano po ang mga risk factors ng osteoporosis?
Pagkatapos ng ating, for our women, pagkatapos mag-menopause, that would be one risk factor. Number 2 po, if we do have other illnesses, no, kung may mga iba pa tayong sakit. Thyroid issue, autoimmune issues, kapag meron din tayong mga maintenance medications, pagkakaroon ng maintenance like steroids for one. Number 2, kung meron po tayong mga anti-epileptic na mga medications, they could also make us more prone to osteoporosis. Other risk factors po kung medyo balingkinitan or very slim ang ating BMI or pangangatawan. At kung meron tayong history or family history of early onset osteoporosis or fracture in the family, it could be risk factors po.
Yeah, balingkinitan. So, I guess hindi ako nagfo-fall doon sa risk na yun, ano? Pero, ayun na po. Doc, nakakatulong rin ba ang pag-exercise, maging physically active para hindi magkaroon ng osteoporosis?
Yes. So, just to jump in lang po dun sa sabi nyo na yung sinabi kong balingkinitan, more of underweight po, no?
Underweight,
Opo.
yeah.
So, mga BMI of less than 18. So, medyo on the slimmer side po. Moving forward to your next question about the exercises. Kasi exercise and weight po kasi actually are good stimulants for our bone to be more stronger. So, doon din natin kailangan i-push for weight, mga exercises that are also enough to stimulate our bones to be stronger.
Or to grow.
To grow.
No?
Opo.
May certain age ba na nagsa-stop yung growth ng bones natin, Doc?
At a certain age, around, ang peak bone density po usually nasa 20s to 30s. After po nun, yung bone loss natin is already more than, or kumbaga medyo nag-a-advance na as we age. Mas nag-heighten po yan kapag at a later part of on the elderly side.
So sila yung mas risky na
po.
Yeah, so Doc, paano naman po, how do we know, syempre, hindi naman lahat po familiar with osteoporosis. Minsan, akala natin masakit lang yung ganito sa katawan or masakit yung likod, yung tuhod. Paano po yung signs and symptoms na sabihin natin, not simple, pero yung lagi na nakikita yung sign na may osteoporosis na yung tao?
Kanina po you were talking about silent disease. So, we do hope to catch these patients before it become non-silent o may sintomas na, no? It's more preventive ang approach natin for osteoporosis, no? So, screening at a certain age po, even if you don't have symptoms, is something that we advocate. For women, around 65 and up. For men, it's gonna be 70 and up. It could actually be earlier depending on the risk factors of the patient. So we hopefully will ask our doctors about it, and also our doctors will hopefully offer that particular screening tests po, no? And then to connect it to your question na ano yung mga sintomas, usually back pains po would already be a sign na posibleng may komplikasyon na tayo ng osteoporosis, a possible fracture in our spine. Height loss po. Medyo yung nakikita natin sa mga commercial, nakukuba, lumiliit yung mga lola natin. That's already a possible sign of osteoporosis that has complications, no? Baka na-compress na po yung gulugod natin.
Doc, ano po yung gulugod? Para po sa kaalaman ng ating mga audiences.
Gulugod is spine.
Spine.
Opo. So, yung spine natin is generally the part of our...
Upright, no?
That makes our body upright from our neck down to our puwet. So, these are still bones po, no? And then, kung nagkakaroon siya ng pagbabago sa height, para po yan, sinasabi ko sa pasyente, para mag-imagine tayo ng chicharon. So yung chicharon, it's solid on the outside, but in the inside, it's brittle and hollow. So pag po nagkakaroon ng pagkalutong, pwede po siyang makompress at magkaroon ng fracture. And that could cause pain, that could cause some deformities like height loss, or pagkakuba ng pasyente po.
So, yun na yung mga sign. Pero ito na yung mga late detection.
Late po, opo.
Yeah.
So hopefully we'll catch the patients earlier before fractures happen.
So to all our audiences now watching us, ang sinasabi ni Doc, pag 60s and above, so mga seniors natin, hindi na natin kailangan hintayin na makita natin yun nga may height loss, no, or masasakit na yung kasukasuan. But usually that's the yun yung laging reklamo ng mga seniors po, di ba? Or pa-seniors na. So, magpatingin na for osteoporosis or para ma-manage ito agad.
Yes.
So, Doc, may question po tayo from one of our audiences. Usually po ba, Doc, ang osteoporosis kahit saan naman po nag-occur sa buto, hindi lang po ba ito sa spine?
Yes. So, yung osteoporosis po, since our body is entirely made up of bones po, the brittle bones can happen anywhere po.
Okay.
So, we are at risk for fractures anywhere in our body, even our hips, even our arms. So, doon po yung pwedeng pag bumagsak ka lang or kapag natalisod ka, a patient who has normal bone density will not have fractures, but a patient with osteoporosis might have fractures already po.
Opo. So, mas mabilis mabalian.
Opo. So,
maputol yung bone.
it can occur anywhere in our body, but for specific test po kasi that we do, we call it bone density test, ang representative areas yung mini-measure natin. The spine and the hips po. But it doesn't mean na doon lang mag-occur yung osteoporosis.
Okay, Doc. So, question before we go for a quick break po, Doc. Paano naman po yung mga seniors natin na nabalian? So, ano pong chances na magdudugtong ulit yung bones nila? Kasi, well, accidents happen po, right? So, paano po yun? Nag-heal po ba yung bones pa ng mga seniors natin?
Depende po sa fracture. So, usually, pag may fracture, we ask the help of our orthopedic surgeons kapag gano'n, no? They have to assess if what kind of fracture it is. May mga iba't ibang types of fracture. Kung ito ba ay isang operable kind of fracture or ito ba ay hindi na inoperahan. But moving forward po on our end naman for the bone health, as a rheumatologist, we have to make sure that it doesn't happen again.
Yes.
We have to make sure, hopefully, that the other parts of the body would strengthen pa. We can give medications to strengthen the bone pa so that hindi pa po mag-progress or hindi ito mangyari ulit.
Okay, so may follow-up question pa sana ako. Pero yeah, we'll be pausing for a quick break. Mga ka-IZ, dyan lamang po kayo, huwag kayong aalis. Half an hour pa po of life balance dito sa DWIZ. Ako po si Toni with Doc Anna.
Life Balance with Kath Mayormita on DWIZ 882.
Ang mag-ipon ngayon, ang unang hakbang para sa inyong magandang kinabukasan. Kung nais mong matulungan sa pagpaplano ng inyong kinabukasan at ng inyong pamilya, bumisita sa Fortune Life website www.fortunelife.com. Siguraduhin i-like at i-follow ang kanilang Facebook page at Instagram account. I-search lamang ang Fortune Life PH. Fortune Life, securing your tomorrow today.
Sa bawat issue, sa bawat balita, katotohanan ang inuuna. Asintado 100%. Malinaw na talakayan sa isyong bayan. Nagbabalita ng totoo at nagkokomentaryo ng tama sa inyong panlasa. Asintado 100%. Tuwing Lunes hanggang Biyernes. Dito lang sa DWIZ 882. Ang himpilang may todong lakas.
Are you lonesome tonight?
Muli nating balikan ang mga awiting nagpangiti, nagpakilig, at nagpabalik ng mga magagandang alaala ng ating nakaraan.
So won't you please come back to me, my dear?
Awit para sa iyo, mga awiting sinasabayan natin.
So play the song the way it used
to be.
Ito ang awit para sa iyo.
An angry silence lay. Well, I'm sorry, my love.
Sa DWIZ 882, ang himpilang may todong lakas.
Ikaw ang mahal kong tunay na tunay. Ang laging panaginip ko'y tanging ikaw.
Come on, let's go to Isuzu Jaguars. You won't regret it. Come on, let's go to Isuzu Jaguars. We've got your back. Isuzu Jaguars, your partner through it all. Isuzu Jaguars, Isuzu Jaguars, Isuzu Jaguars. Let's journey together.
Visit Isuzu Gencars Makati, Isuzu Santa Rosa, Isuzu Batangas Santo Tomas, Isuzu Batangas City, Isuzu San Pablo, Isuzu Legazpi, and Isuzu Naga.
Life Balance sa DWIZ 882, ang himpilang may todong lakas.
Ay po ay nagbabalik sa ating programa Life Balance dito sa DWIZ 882. Ako po ang iyong host, Toni. Bago po natin simulan ang part 2 ng ating programa, panoorin at pakinggan ang aming health supplement for today.
Maraming tao ang sanay na mag-self-medicate o basta uminom ng gamot nang walang payo ng doktora. Pero may kaakibat itong panganib sa ating kalusugan. Kapag mali ang iniinom na gamot, maaaring hindi gumaling ang sakit o lumala pa ito. Lalo na sa antibiotics. Hindi ito dapat iniinom basta-basta o basta itigil kapag gumaan ang pakiramdam. Ang maling paggamit ng antibiotics ay maaaring magdulot ng antibiotic resistance kung saan humihina ang bisa ng gamot laban sa impeksyon. Kapag nangyari ito, mas nagiging mahirap at delikado gamutin ang sakit. Mahalaga ang tamang konsultasyon sa doktora bago uminom ng anumang gamot. Sundin din ang tamang dosage at buong gamutan kahit bumuti na ang pakiramdam. Sa huli, ang pag-iingat sa paggamit ng gamot ay proteksyon para sa ating sarili at sa mas epektibong paggamot sa hinaharap.
And today we have our very special guest from Makati Medical Center, Dr. Ana Estrella, a rheumatologist. And pinag-uusapan po natin today ang osteoporosis. Ayan, marami na po tayong napag-usapan, Doc. But this time, let me ask you about bone density test at paano ito ginagawa. Masakit po ba ito?
So, unang-una hindi po ito masakit.
Okay,
no? So, bone density test, sa pinag-uusapan natin kanina, osteoporosis, it's one of our ways, or actually the gold standard way of assessing or alamin kung gaano kalutong ang buto natin. It's usually not really a painful procedure naman po, no? It looks like an x-ray machine lang din po.
Okay.
Pero iba po ang mini-measure niya, no? Gaano kalutong ang buto. I usually tell patients it's a pretty pleasant experience, unlike other imaging. May mga imaging modalities po kasi na medyo hindi uncomfortable.
Yes.
But usually, patients don't feel anything naman po. It really looks like, it's a fast procedure. It looks like an x-ray machine. But iba lang po ang mini-measure niya.
Okay.
Lutong ng buto at certain parts of our body, like our spine, our hips po, which could represent the bone density of our whole body.
So x-ray, so parang from the sa result makikita niyo na yung structures ng bones. So may mga paano po niyo naman na
numero po actually siya, no,
okay.
that we usually judge, no, tinitingnan kung magfi-fit sila sa luto, kung gaano kalutong ang buto. Para lang po siyang machine na dadaan lang tayo, tapos or may nakahiga tayo, tapos dadaan tayo sa kanya. And then, mamimeasure na in numbers yung lutong ng buto po. At yung numbers po yung ina-assess ng mga doktor.
Alright, so doon magigauge kung gaano nakalutong or kalambot yung buto. Oo,
tama po.
Tama. Gaano naman po kadalas, Doc, ang dapat magpa-check up kung may panganib na magkaroon nito? So, yung mga taong may risk na. Yes.
Po. So, we were talking about earlier yung risk factors, no? postmenopausal or earlier kung may mga additional risk factors kayo, we usually do our screening test and then repeat it after 1 to 2 years po. We usually judge, depende kung ano ng level ng lutong ng buto ninyo, if candidate na po kayo for medications for osteoporosis. And yung bone density test natin, we usually repeat every 1 to 2 years. On top of our bone density test, we usually also ask for calcium level, vitamin D levels po sa katawan, dahil lahat po ito ay all relating to bone health, no? So, kailangan sila lahat ma-normalize or ma-optimize po.
So once, Doc, naman na-diagnose na may osteoporosis, maari po bang mapalakas ulit yung mga buto natin?
Opo. So, yun po yung hopefully makuha nating punto sa timeline ng isang pasyente that we could already intervene. So, on top of our calcium, vitamin D supplements, we can give medications. Depende po sa klase ng osteoporosis ng pasyente. There are some medications that are taken orally, lingguhan or buwanan. There are also some medications that are given in IV form or injectables every 6 months. Meron din pong mga medications na kung ang layunin natin ay tumibay ang buto ng isang pasyente may severe osteoporosis, may mga injectables din po na every day or every month po. So, depende po sa category ng pasyente.
Oo. So, the patient has to go to the hospital pag ganito, Doc? Pag injectables na?
Usually po, opo.
Okay. So, Doc, habang buhay na po ba to? For example, may osteoporosis sa isang tao. So, buong buhay na po ba nila na magme-medication sila?
Ang osteoporosis po, yung diagnosis ng osteoporosis, kung panghabang buhay po yan, it depends on the bone density test. So usually kung nakuha po natin at na-judge na kayo na may osteoporosis, we give intervention, we give medications, we repeat the bone density test after 1 to 2 years. If pwede po siya mag-improve, no, yung mga numero natin, pwedeng maging osteopenia na lamang, which is a lower level. Osteopenia.
Osteopenia. So may lesser version palang osteoporosis.
So parang may mga leveling, tama po kayo. So may normal bone density. If medyo malutong pa lang, na hindi pa po malutong na malutong, we call it osteopenia. And then, pag malutong na po talaga at very high risk for fracture, we call it osteoporosis. So, pwede pong maging osteopenia na lang ang isang pasyente or tumibay-tibay ang buto. It depends po on the numbers din.
Kaya ito talaga yung importance ng laging nagfa-follow-up check-up, no? Saka pagdating sa certain age, sabi niyo nga, pag senior na, dapat talagang magpa-bone density test na.
Yes, okay.
So, Doc, sa Makati Medical Center, ano po ang mga serbisyo para sa osteoporosis para sa mga patients ang available sa Makati Med?
We are complete naman po with our assessment tools for osteoporosis. So, we have doctors who can cater to patients with osteoporosis. So, we have rheumatologists, internal medicine specialists, endocrinologists. Kung meron na po tayong unfortunately fractures, we could also ask help from our orthopedic surgeons, rehabilitation medicine specialists also. So mapapansin niyo po yan, multidisciplinary, especially for cases that are a little bit complicated. In terms of diagnosis naman po, we are also very much complete. Calcium levels, we have the necessary laboratory equipment, vitamin D, and yung gold standard text test po that we were mentioning kanina, bone density test. It's also known as DEXA. Or BMD. This is also available in Makati Med. Unfortunately, it's not readily available everywhere in the country. Usually, mga select hospitals po ang meron, and Makati Med has one.
Well, that's great to know. Thank you, Doc. Sa lahat po ng ating mga audiences, patuloy po tayong magkikwentuhan ng makabuluhan tungkol sa osteoporosis. Mag-break lamang po tayo. Kami po ay magbabalik.
Life Balance sa DWIZ 882, ang himpilang may todong lakas. hataw na, umaga na, kaya bangon na. Lakasan na ang mga radyo. Buksan na ang mga Facebook at YouTube. Tutukan ang mga humahataw na mga balita at patas na komentaryo ngayong umaga. Kasama ang mga pampa-good vibes na tugtugin. All in one. Lunes hanggang Biyernes, alas 4 hanggang alas 6 ng umaga. Hataw na, umaga na. Dito lang sa DWIZ 882. Ang himpilang may todong lakas. Namnamin ang bawat lyrics na mga awiting tumatak na sa iyo.
Ako'y isang Pinoy sa puso't diwa.
Namnamin bawat himig na mga awiting kumiliti sa iyong imahinasyon.
Hello darkness my old friend.
Mga awiting kasama mo na mula noon hanggang ngayon. Mga walang kamatayang awitin na nagkaroon ng marka sa iyong puso. Sundays, Weekend Delight, alas 6 hanggang alas 9 ng gabi. Dito lang sa DWIZ 882, ang himpilang may todong lakas.
Hindi nga masamang pag-unlad kung hindi nakakasira ng kalikasan.
Music of your life. Mga awiting magpapabalik ng inyong nakaraan. Music of your life.
Don't look so sad.
Mga awiting magbibigay ngiti sa inyong mga labi. Music of your life.
Photographs and memories.
Ang mga awiting magpapaalala ng mapait mong karanasan. Music of your life. Isang programang magbibigay ng inspirasyon, masaya o mapait man ang naging alaala ng iyong kahapon. Kasama si Pretty Boy Marco, alas 7 hanggang alas 9 ng gabi, Lunes hanggang Biyernes. Dito lang sa DWIZ 882, ang himpilang may todong lakas.
We'll see you through.
Life Balance on DWIZ 882.
Kasama niyo pa rin po kami dito sa DWIZ 882 sa Life Balance. At muli ako po si Toni, kasama ngayon si Dr. Ana Estrella of Makati Medical Center. Doc, so ayan, pinag-usapan pa rin po natin ngayon. Ang topic is osteoporosis. And let's dove right back to our question kanina, no? So kanina natanong ko po, paano naman kapag na-diagnose na may osteoporosis, ano Doc yung mga interventions naman or mga do's and don'ts na pwedeng gawin ng mga tao na may osteoporosis?
So, pag na-diagnose na tayo na may osteoporosis, we'll have to ask the doctor ano po yung mga bagay sa ating mga gamot, no? Aside from calcium, vitamin D, mag-expect lang po tayo ng mga additional gamot that are meant to strengthen our bones, no? So, yun yung mga na-mention natin kanina. Sa bahay naman, marami rin tayong pwedeng gawin, no? Number one, yung exercise po that we were talking about earlier. Weight-bearing exercise is something that is very, very helpful for us to strengthen our bones and also for our muscles po para ma-strengthen din at magkaroon tayo ng muscles because that supports our body.
Yes.
Ang goal kasi natin is not to strengthen the bone and for us not to be very prone to fall o pagkahulog. No? Ang pagkahulog po might be a cause for fractures,
no?
which we don't want to happen for patients with osteoporosis. On top of exercises, a healthy balanced diet with calcium and making sure our vitamin D levels are all optimal. And then one thing po that usually na kakalimutan ng pasyente are things that we can do in our environment. Meaning, which are to decrease the risk for falling, which are to make sure po that the yung mga slippery areas in our home, banyo,
Okay.
are all fall prone po, no? Na ma-make sure that they're not our patients with osteoporosis are not at risk for falling. So, ano po ba yung usual interventions? Putting handrails
Yes, handrails.
in the guide.
Sa stairs, sa bathroom, ano po.
Opo. And then, ang rubber matting
Rubber matting.
in our CRs po, no? Siguro, kapag ang patients natin ay medyo hindi na siya mas lakas masyado or hindi na niya kayang nakatayo the whole time habang naliligo, we can usually also put a stool
Yes,
so that
yes.
we can, while taking a bath, nakaupo na lang para less po yung risk
Risk
for
of
fall.
fall. Yes.
Loose wiring in our floors po na pwedeng matrip at mahulog ang isang pasyente. Mga corners po of our tables,
yes.
furnitures, na pwede pong madali tayo at matapilok, no? Usually, binibiro ko po yung pasyente, parang balik baby tayo,
Yes,
no?
oh, that's true though. Kasi yun yung mga baby-proofing the house, right?
Yes.
Para hindi mauntog yung baby. But this
Yes.
time, for our elderlies naman,
Yes.
yeah, for our senior family members,
Opo.
na para make the house or our home safe for them.
For them. I also tell them to empower or let the patient po be comfortable enough to ask help from our companions and watchers.
Yes.
Usually, it's something that we forget also for our elderly patients kasi minsan po nahihiya na silang manghingi ng tulong dahil ayaw nilang makaabala
Yes.
majority of the
Yes,
time.
opo.
So, we always tell them na mas madaling humingi ng tulong kaysa magkaroon tayo ng aksidente sa bahay.
Yes.
So, magpaalalay kapag naglalakad or nag-aakyat panaog ng hagdan, tungkod po or something that will make us more stable when they're walking.
Yes. So talagang parang baby na talaga, no? Na
Yes.
talagang someone will have to take
Assist.
care or assist them
Opo.
for support.
Opo.
Ayan. Doc, ito, question po ng one of our listeners. Totoo po bang osteoporosis ay sakit lamang ng tumatanda?
It's usually in the elderly, but hindi rin po siya exclusive sa elderly. So, yung risk factors po na minention natin kanina, so kung kahit hindi pa po sila matanda, if they have other illnesses that make them more at risk for having brittle bones, pwede po na hindi pa sila 60 years old pero meron ng
Yes.
osteoporosis. If they're taking also medications that are ang side effect ay makalutong ng buto, pwede po kahit bata sila magkaroon ng osteoporosis.
Yes.
So,
Is it also true, Doc, na kapag nanganganak yung tao, nababawasan yung calcium or yung bone density natin?
yung calcium po, opo, mas higher yung requirement natin for pregnant and for lactating mothers, no? So, kapag ganun po, we usually advocate higher amount of dietary calcium in them. But hindi naman po necessarily or hindi siya automatic na kapag nanganak kayo, osteoporotic na kayo. Hindi naman. Pero,
mas higher risk.
higher-
Nagpapatake yung mga OB, right? Ng mga
Calcium supplement.
supplements pa.
Opo.
Kasi a glass of milk won't suffice for the growing baby inside, no? Oo, tsaka yung bone na din ng mother.
Apa.
Oh, yeah. Alright. So, Doc, meron naman po daw bang epekto ang sobrang pag-inom ng soft drinks sa kalusugan ng mga buto?
Okay. So, yung soft drinks po, technically, wala kasi siyang calcium, no? So, we're not getting enough
Sugar lang.
sugar.
Okay.
Opo. So, it's more detrimental that way po, no? We're, mas at risk tayo for metabolic diseases, dehydration, because all of these soft drinks are also prone for us to urinate a lot. So, we can be dehydrated, uric acid, so more metabolic diseases po. In terms of calcium, nakikita ko pong connection is that because it doesn't have any calcium in it, and it's not really helpful for our bone po.
So, ayun, yun yung dahilan. So, I guess ang nagtanong nito, younger generations, ano, soft drinks. Okay, Doc. So, for our last question, so ayan, mga, I can believe almost an hour na tayo nakikwentuhan, Doc. Okay, may mga maling paniniwala po ba ang tungkol sa osteoporosis na gusto niyo pong i-clear sa atin, sa amin pong mga non-medical persons?
Siguro po yung kaninang isa sa mga questions natin sa umpisa na osteoporosis is different from arthritis and we don't wait for symptoms po for us to manage or for us to think about osteoporosis. Hopefully po ang ma-impart ko sa mga patients or sa mga listeners, mga nanonood sa atin today is that for osteoporosis, ang goal natin is prevention. Prevention of fractures, the complication. We could already intervene at an earlier point in time. Supplementation and the proper screening test po. And to seek health advice to the proper doctors po.
I guess what you're saying is that prevention is truly better than cure.
Yes, especially
po ba,
for
Doc?
this case.
Yes, for this case. Ayan. Mga ka-IZ, ito po, nandito na po tayo last minutes of our life balance today. But wag po kayo mag-aalala, babalik po kami ni Doc for another helpful tips. And of course, ang ating po magiging topic is arthritis para naman makita natin ang difference nito truly sa osteoporosis. Ayan, mga ka-IZ, again, ako po si Toni, and thank you again, Doc Anna. Glad to have you here again on our program. Magbabalik po kami, mga ka-Life Balance, dito lamang sa DWIZ 882.
Life Balance sa DWIZ 882, ang himpilang may todong lakas. Sa bawat issue, sa bawat balita, katotohanan ang inuuna. Asintado 100%. Malinaw na talakayan sa isyong bayan. Nagbabalita ng totoo at nagkokomentaryo ng tama sa inyong panlasa. Asintado 100%. Tuwing Lunes hanggang Biyernes. Dito lang sa DWIZ 882. Ang himpilang may todong lakas.
Are you lonesome tonight?
Muli nating balikan ang mga awit Toni Magsano ang Walang Bulahan. Tuwing Sabado, alas 4 ng hapon, dito lamang sa DWIZ 882. Ang himpilang may todong lakas. Walang Bulahan. Sa bayan din masusubaybayan sa Aliw Channel 23 at sa social media accounts ng DWIZ.